Let me begin by, on behalf of New Frontier, to welcome all of you to this Global Health Care Summit, gathering together all relevant personnel to analyze, if not to improve, health. Benjamin Franklin once said that health is wealth. And our own president, President Xi Jinping, always tried to promote Gong Fu. So to achieve wealth, all we need really is health for all. Now, promoting health practices, or for that matter, traditional medical practice, be it Western medical practice, traditional Chinese medicine practice, or even chiropractic, etc., has really stood the test of time. They're all consisting of making diagnosis, applying treatment, and ultimately rehabilitation. Sometimes all these are very, very tedious, needing vast experience, and I have to say, with a little bit of guessing game and also a bit of luck. It is on this assumption that we will be exploring today how much can modern technology help to improve and streamline the whole process. Let me clarify that I'm no expert. Being brought up in an era where technology is minimal, other than having a stethoscope, 一個聽筒, or an ophthalmoscope, and perhaps a fiber optic light source. Yet I believe in traditional medical practice, but at the same time, like all professionals, you have to 與時並進. Accept what can improve you through modern technology, and at the same time, be critical. As the old Chinese saying goes, 水能載舟，亦能覆舟. There are areas of shortcomings of technology. It is on this principle that I will attempt to use my limited experience to showcase examples of benefits of technology and areas that I believe are fallacies of technology, and finally, how using technology critically will improve medical practice for our patients. Areas where technology will be, can I have the slide, please? Can be of benefit. These are very obvious. In diagnosis, using telemedicine when people are far away in rural areas, when you are having a pandemic, patient self-monitoring using a monitoring device, big data, giving more accurate clinical diagnosis, technology imitation like CT scan, MRI, and also what we heard today, using no tubing to do lung surgery. It's also used in treatment. Next slide, please. Using robotic surgery, using stenting aortas for ruptured aneurysms, using stenting arteries, using stenting ureter, and also in family planning, using a scientifically assisted human reproduction, using a lithotripsy to break up stones, and using ultrasound treatment for brain diseases. It also can be used in rehabilitation, such as electronic artificial limbs. But there are fallacies of technology. Remember, as healthcare professionals, we are treating patients, not just disease or pathologies. Here is where technology fails to apply. Telemedicine can give a diagnosis at a distance, perhaps a more evidence-based diagnosis, but it takes away the doctor-patient relationship, which all of us will agree is an important element to help our patient get mentally and physically well. To a trainee, they lose all the training of how to gain patient confidence. The traditional man chit is gone. You give up all the importance of physical science and physical examination. You are being dictated by the computer in applying the treatment. Technology can easily retrieve an ovum or an egg and have it stored for future use. Scientific technology can store sperms and ova can be fertilized in the test tube to form embryos and reimplant back to the mother or a borrowed uterus for pregnancy. For the same score, the sperm or the ovum could be borrowed. A child is born to the delight of the married couple, but what is there in store for the welfare of the child who could have no DNA similarity to either parents or to either or both parents? Similarly, there is technology to allow the parents to choose the gender of their embryo, upsetting the nature's male and female balance ratio. There are, of course, other areas of concern: privacy issues, phenomenal costs of using advanced technology, but who is to argue and dispute that life is more precious? Colleagues, ladies and gentlemen, as a healthcare personnel, our dictum must be patient first. It is our responsibility to strive to give our very best to our patients, be it in diagnosis, treatment, or rehabilitation, to get them well, both mentally and physically, using continuous improvement in clinical judgment, experience, modern technology, and up-to-date pharmaceuticals, knowing very well they all have benefits and shortcomings. Using them rationally, benefits will outweigh shortcomings. We must recognize that rational use of technology will enhance traditional medical practice. We must also recognize that technology is not a replacement of traditional medical practice, but it's a complement to it. Medical medicine basically is an art and will always remain an essential component of patient care. Now, this crossroad between technology and traditional medical practice is thus a pivotal movement in the development of healthcare. By embracing this crossroad, we can create a more efficient, effective, and compassionate healthcare for the betterment of a patient and society to serve. In the next few sessions, we'll be introducing experts in telling us what technology can help in our medical practice. With that, thank you very much.